My diagnosis was in 2018. I was 16 years old in Venezuela. The doctor, when he saw this, he told me it was like idiopathic adolescent scoliosis. When I run or when I do some exercise, like it's with effort, like physical effort, it's like it's a little hard to breathe. So now I know when one of my curves is making pressure to my lungs. So breathing, it's like a little hard and painful when I was growing. So when I grow every year, it's like, or every more time I grow, it was getting more worse, the pain.
One common question I always get asked when the patient has scoliosis is, can scoliosis affect the way I breathe? Can it affect my lung capacity? Can it affect respiration? In fact, that's one of the largest motivators that scoliosis surgeons use for patients to actually consider surgery. And one of the concepts here is what's really happening, how big does a curve have to become to affect the respiration? And the answer is nobody really knows. And the reason why, because it's not like the spine is physically going to press on your lung and cause it to fail. What's happening is that the spine is becoming stiffer, and the stiffer the spine becomes, the more difficult it becomes for you to take a deep breath, because during breathing, your spine should flex. And the stiffness and the curvature is what stops it. So sometimes patients with small curves, like Christy's, can feel this difficulty or restriction in breathing. Sometimes they don't. Sometimes larger curves feel it. Sometimes they don't. So it's not really relative to curve size. It's more relative to stiffness. Now, for an 18-year-old to feel restriction in breathing with a 37-degree curve isn't the most common thing, but for her, it was a real impact.
I have 4 curves. The worst one was 35. Now it's 25, so it's 10 degrees. Like all the 4, it's like kind of go to 10 degrees lower. So that's really good. And my shoulders, I see the difference now. In just 9 days of treatment, I see it's like they're more even. I feel happy. I feel like I'm gonna do something better for my body, for me, feel good for me too. Like really happy, and now I see the results.
Going from a 34-degree to a 24-degree scoliosis is a big deal. 10 degrees when it comes to scoliosis is a huge amount of change. You gotta understand, in traditional treatment, at 25 degrees, they recommend nothing, or just starting to recommend something, maybe a brace or something like that. But when they get to 40, they recommend surgery, and that's only 15 degrees of change. To think we got that same change in a 2-week reduction, it's remarkable. This is a really testament to how effective the treatment can be when somebody's really motivated to go through the process.